Somehow down the road in building my practice, which is now 5,000 patients on Park Avenue, Manhattan, became known as an acne specialist. As a matter of fact, I launched an acne skincare line with L'Oreal in the mid-2000s. And I've just become very well versed and very good at clearing acne. It's a real task because there can be so many culprits. So my first step when I see an acne patient is to try to identify an underlying cause that's external. So this includes liquid foundations, powders, other types of topical agents like pomades or gels in the hair. You can tell when it's an outside job because typically they get what I call subterraneans or plugs in the skin, in the pores. So if your customer has what looks to be plugging, they really should look at what type of liquid foundation they're using, and they really should not use powders because powder spicules can get stuck into the pores and cause a backup, and that could be the start of an acne blemish. Now, in terms of tips, using your cleanser as a step to deliver medicine, and then in terms of topical anti-agers, making sure that it's non-comedogenic. So in terms of cleansing, well, I formulated the 37 cleansing treatment with niacinamide, which is anti-acne, and 2 other vitamin Bs, which are anti-sebum. And it also has green tea and aloe, which diminish inflammation. And acne is an inflammatory disease. So you really can't underestimate how important it is to decrease the inflammatory component using agents that decrease inflammation to the tissue. It also has a number of anti-rosacea meds in there, which are very, very helpful. And the same thing goes with your topical anti-aging cream. You have to make sure that it's non-comedogenic. It should not have petrolatum or oils. And additionally, you should look for ingredients that will help soothe the skin so that the acne inflammation decreases. When choosing a therapeutic modality, what you want to do is pick a therapy that has a reputation for not leaving scars. And this may not be immediately obvious, but for example, Accutane, while extremely effective, is really notorious for leaving scars in the wake of all of its acne because Accutane impedes wound healing. What we're looking at here is arming the skin with what it needs to do its job so that it heals maximally. And this is where things that boost collagen levels are going to be extraordinarily helpful because most acne scars are what we call atrophic or pitted scars. There's not enough collagen there. And so what are the things that will induce collagen during wound healing? And these include the peptides, which will directly upregulate collagen, but also, and I put this in 37, and this is something that I have found has been extremely helpful during the wound healing phase of acne, small molecular weight hyaluronic acid. Hyaluronic acid, if it gets deep into the tissue, can really help in boosting collagen formation and preventing scarring.